Hello, I'm Dr. Julia-Heya welcoming you to this video entitled Ankle Sprain, What to Do. Actually, we can talk about any ankle injury and what to do. I treat pain and injury below the knee in Meadville, Pennsylvania. So let's assume that you saw someone, maybe your family or one of your friends or just someone in your neighborhood or nearby fall, and you can tell that their ankle is bruised, they're complaining of pain. You ask them, are you all right? Did you hit your head? Are you dizzy? They'll say, no, I was running, I stepped in a hole, what have you. So what should you do immediately? Hopefully you are close to your home or close to a place where you can pick up some gloves, grab some Purell or wash hands, and try to help the person out. If possible, even get a bag of ice or one of those ice packs that's available over the counter. It's important to always, when helping someone who's injured, whether you know them or not, to always exercise what we call universal precautions. And what that means is always treat someone that you're going to touch as though they may have a contagious disease, a communicable disease. For example, blood, if they're bleeding, if they have a draining wound, if they have pus coming out, always wear gloves to protect yourself, reduce the chances of you picking up a contagious disease. And what I'm speaking about is blood and body fluids can transmit HIV/AIDS, hepatitis B, C, or Delta, or even just a bacterial infection. So I'm going to put my gloves on. I've already washed hands. Immediately after an injury, regardless of whether it's the ankle, the knee, the hip, the shoulder, immediately rest, ice, and immobilization are recommended. Ice is generally recommended for the first, say, 2 or 3 days. The cold actually reduces the amount of inflammation. So if you treat an ankle injury, any joint injury with ice, do not put the ice directly on the skin. Put a layer of fabric, either a sock or a towel, between the skin and the ice. If you don't have access to an ice bag, just use frozen vegetables, a bag of frozen vegetables, a bag of frozen fruit. And once the skin is too, feels that the ice is too much, too cold, only leave it on, again, with a layer of fabric between the skin and the ice. Only leave it on for maybe 3 to 5 minutes, then take a break before you put it back on again. Try to, the patient in a comfortable position, and use either an ACE bandage or a conforming elastic that sticks to itself. Always begin wrapping right behind the toes when we're wrapping an ankle. Put just a little bit of like a snugness to it, not too tight. Another reason to keep the toes exposed is if the bandage is too tight, then the toes, the skin, will become either very pale or very dark. If that happens, immediately remove the dressing that you're applying. Do not underestimate an injury. Do not assume that just because a person can bear weight on the extremity, therefore they do not have a more severe injury like a fracture. None of us have X-ray vision. Fractures can only be ruled out or deemed not present with medical imaging, and I'm speaking of either an X-ray or a diagnostic ultrasound device. Stress fractures, hairline fractures, very small fractures do not show up on an x-ray until after 10 to 14 days have transpired since the injury. So it's best to assume that the injury is worse than it seems. Once you have wrapped the ankle, once you've applied the ice, then ask the person or assist the person to seek medical attention. If you know a physician who treats the ankle, as I do, call that office, make an appointment. If you don't know who treats an ankle injury, then seek an urgent care facility. Freestanding facilities that are open for, say, 12 hours a day, or even an emergency room. Always, when you have finished bandaging the person, try to get crutches or a walker for them to wear, or some sort of a splint to offload the injured area. When you are finished wrapping or bandaging the injured joint, then always remove your gloves and wash your hands. Remember that if the injured body part is bleeding, then do ask the person whether they may be on a blood thinner and anticoagulant. I'm speaking about warfarin, Coumadin, Eliquis, Xarelto. These are blood thinners. No matter how much bandage or dressing or compression you apply to a bleeding wound of someone who is on a blood thinner, the bleeding will not be controlled. They must go to the emergency room and receive an antidote. Thank you very much for watching this video about treating an ankle sprain, an ankle injury, what to do. Please like the video below, comment and share. I'm Dr. Julia-Heya reminding you to wash your hands and think of me below the knee.